Hello, myself Dr. Vinita. I'm MPT Ortho. So we are starting the lectures. So first lecture is what is a fracture. Fracture is a medical condition in which there is a partial or complete break in the bone, often documented as in this form in notes. So what cause a fracture? So mainly the causes of fracture is usually result of high force, impact or stress. So it may be secondary to underlying medical conditions such as if patient having osteoporosis, osteopenia, bone cancer, osteogenesis imperfecta. So these may be the regions where the fracture occurs. In case of the fracture being due to weakness of the bony structures, the fracture is termed a pathological fracture. So it's depend upon what the terminology we are using. So due to the impact, there is another, that is stress fracture. And if a pathological fracture we found, what that may be due to the weakening of the bone structure. So that is different. What is bone made from? So before we go advanced in the fracture or pathology, so we have to analyze the bone is made up of collagen, the connective tissue, the protein collagen provides soft malleable framework. Mineral calcium phosphate is added to provide strength and harden the bone. So all these together make a bone. So we have to very particular if there is calcium deficiency, or there is a strength or weakness, or part is not hardened. So according to x-ray or pathology, we can find such pathological conditions and we treat patient accordingly. Bone structure. So first we analyze the bone structure. Here I just give the picture of the bone. The outer layer bone is called the cortical bone and is hard and compact layer, and the inner layer bone is called the trabecular bone, has a honeycomb structure and is more malleable. So we have to be more conscious or towards the structure, because when there is a osteoporotic or osteopenic patients, there we found what the malleable structure outside also. So the hardened part is become you can say reduced, and yes, it become ductile and it easily fractured. The bone remodeling phase. Throughout our life, our bones are undergoing a process called remodeling. This process involves the constant breakdown, resorption, and renewal of old bone formation. In early life, the bone formation outstrips the process of resorption, and so the bone gets stronger. In osteoporosis, the process of resorption outstrips the process of formation, and the bones get less dense. So when we found some x-rays like in older people, what we found, the honeycomb structure we found outside also. So there is osteoporosis, so the remodeling is not happening that time. And in young also we found that people who are not going outside, who are not eating properly, their food habits, and their sedentary lifestyle, they are not going early morning outside, so they also having the same structures in their bone. Next we go to the fracture. There are several different type of fracture based on the way that the bone has broken. So here we see the picture that how the fracture happen, like fracture are hairline fracture, comminuted fractures, and many more. So I will explain you in a separate lecture what type of fracture and how they occurs. So common fracture sites are mainly fragility fractures are at the neck of the femur, wrist, spine. So most common fracture treated in MSK or physiotherapy. What are the neck of humerus, ankle, wrist? These are the main fractures which we found in human beings. Healing process is a different. So how healing is occurs, like soft tissue injury is happening, and there is also a healing process. So it's sort of similar process. So what we see, that hematoma formation, then fibrocartilaginous callus formation, then bony callus formation, then bone remodeling. So after a fracture, the blood vessels bleed in the injury site. Soon afterward, the blood vessels constrict, preventing the further bleeding. Within a few hours of the injury, the blood cells form a clot called hematoma. The hematoma acts as a template or a matrix for the formation of callus, which is the next stage of healing. So if there is a callus formation, it's a positive sign. Then stage of granulation, the hematoma then causes the release of inflammatory mediators with the inflammatory response peaking at the round of 24 hours, being completed by about 7 days. So granulation phase is for 7 to 14 days. The there was a formation at the injury site. A loose bundle of cells interperse with the blood vessel, which is known as the granulation tissue. It is this stage that the dead bone and other necrotic tissue is removed. So when there is a hematoma and after that granulation, there are some tissues which are dead, and they are not participated in the further formation or further process. So that being removed by the body, and uh, the the tissues or the bone or the blood which is good, or blood vessels, so they help us in the callus formation. From 7 to 9 days post fracture, the cell on the either side of the fracture gap begin to transform into a stronger hyaline cartilage. What we need for the outer membrane of the bone, that is hyaline cartilage. Cell within the granulation tissue also begin to transform into hyaline cartilage. The two ends grow across the gap until joined together is what known as the callus. This peak at around 14 post fracture days. So trabecular bone formation. The next stage is the replacement of hyaline cartilage with lamellar bone. So the final structure, we can say, the bone is more mineralized, stronger and less flexible than the hyaline cartilage. Eventually, all of the callus is reformed as a lamellar bone, which takes the form of trabecular bone, giving the bone most of its original strength. The last stage, remodeling. This process begins 3 to 4 weeks after fracture and has been documented as lasts for 3 to 5 years to complete. This substitute the trabecular bone with compact bone. This compact bone more closely resemble the shape and size of the original bone. Then what is the Wolff law? Wolff law states that a bone is healthy mammal will adapt to the load under which it is placed. This is true for healing too. Loading helps the bone to heal stronger and gradual increase in loading. So what the main thing for physios is that after the fracture, the ortho treated the fracture and they send it to us because we are gradually giving them the loading process. So we are following the Wolff's law, and that helps the person heal stronger and gradually increase the loading. So that allow bone to gradually adapt to increase stress and become more stronger. So we are following the Wolff's law. Factors that influence healing, that are many factors which influence healing, like systemic factors include age, nutrition, general health, comorbidities, atherosclerosis, hormonal factor, anti-inflammatory medication, smoking. And there is local factors too, like degree of trauma, area of bone affected, abnormal bone, degree of immobilization, disruption of the vascular supply. So these are according, like age factor is more important, because if the person is older, then the process of healing is delayed. And if a person is not healthy enough, not taking good healthy foods, or he's like on medication, or he's smoking continuously, or maybe drinking. So it affects the health, and ultimately it affects the bone healing. So local factors also, maybe the degree of trauma, like how much injury to that person, or where is that injuries happen. Like if there is a knee joint, it is more mobile, so patient can't hold that part for a longer duration, and how he is treated by the orthopedician. There is some reference also. If you like the lecture, you can just thumbs up, and give me more feedback, so that I can make more lectures for you.